Okay. All right. So tell me your name, where you're from, and a little bit about your story.
All right. I'm Katherine Taylor. I am 57, soon to be 58 next month, years old. I am in Virginia Beach, Virginia. I was diagnosed at 56 years old with hypermobile Ehlers-Danlos, which of course I've had my whole life. So at my mid 50s, I'm figuring out how my body works. So there's just a lot of stuff with my hypermobility that I just never really knew was causing problems. And I had been, a lot of stuff had been blown up medically throughout my life as you're too young for this much pain. There's nothing wrong with you. The MRIs don't show anything, just a lot of different stuff. And so getting my Ehlers-Danlos diagnosis really helped me advocate for myself and also know kind of what was going on behind it. So I can't work anymore physically. So literally it kind of became my job to research and discover what was going on with my body. So I decided to fix what I could, learn to live with what I couldn't, and adapt to what was kind of changeable. So I'm one of those that if somebody says there's a surgery to fix that, I say go for the surgery. So I had problems with my lower back in my 30s, and went through a lot of PT and stuff like that, and had sciatica, and that was not diagnosed. I was told I was fine. I had an epidural injection, clearly in the wrong place, and that never worked. And I just gave up. And I learned through like Pilates, yoga, which I'm not supposed to do, in different ways to manage my own pain. But then I got my lower spine, I got my cervical spine, I got MRI, and I got an MRI of my lower spine. My cervical spine was fine. I was told it was completely fine. A little bit of arthritis. And my lumbar spine came back as well, fine, by my doctor. But I read my radiology report and it said LSTV. So I looked up what that was and I was like, oh my gosh, that's it. That's what I've had since my 30s. That's what I've been accommodating and da 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 da. So I looked up LSTV on Facebook, and Facebook has actually given me there's a lot of different groups for these very specific rare conditions, which led me to Dr. Jenkins. Dr. Arthur Jenkins went to him for my LSTV diagnosis. Clearly he was the expert, and I wanted, clearly to know what was going on, in order to fix it if I could fix it, learn to live with it and how to do that if I could. And I sent him all my radiology reports, and it just awesome. So I had my first meeting with him, and first of all, I didn't have my standard 15 minutes. I had his full attention, I think, for an hour. Who knows? Probably longer. And he said, yes, you have Bertolotti's and Bertolotti's.
Bertolotti's, like that's how I say it.
Yes, you have Bertolotti's, but we need to look at your neck first, because you have critical cervical stenosis. So I have congenital stenosis of my spinal canal, and he went through everything else that was going on with my neck, and it literally diagnosed pretty much everything that was going wrong with me at that time. I had dysautonomia, so which is one of the things with people with Ehlers-Danlos is they have dysautonomia. A lot of people have POTS, postural orthostatic tachycardia. I was tested for that. I did not have that. I still had I had tachycardia, shortness of breath. I had vertigo. I had pre-syncopal drop. My cardiologist was trying to figure it out. And, everything from my kidneys to, um, my heart was okay. So anyhow, Dr. Jenkins said also with my stenosis of my cervical spine, that I was getting sympathetic nerve chain stenosis. So he gave me a stellate ganglion block. He ordered that, and I went to Dr. Spinner and got that done. And it was a switch. My dysautonomia symptoms went away. So I have not taken any of my dizziness. I'm meglicine, self-medicated because nobody else believed it. So twice a day, meglicine I was taking for that. If I didn't take it, I was dizzy in bed all the time when I woke up, and I couldn't turn my head. And the whatever maneuver, what's the maneuver with your head where they do it? And if you still get dizziness, it's like, it's Meniere's if you do it.
Yeah.
At the Epley maneuver
Something.
or something like that. Anyhow, so it was idiopathic. So I had that, and I stopped anything with my vertigo medication since right when I had that stellate ganglion block. I had this, and then we ordered also as diagnostic, because that was diagnostic. And then we put me in a Vista collar for 2 weeks to see how that would help with my symptoms. And it was like a miracle. So just putting the collar on, my symptoms were gone pretty much the next day. What I was living with, it picked up in about July of the summer. It just been progressively getting worse, which was my headaches had been changing. I have migraine with aura, if they are migraines. I've been diagnosed with TIAs. I've gone to the hospital in an ambulance as a stroke patient. And I had my carotids tested a long time ago, but they never tested. It was my, I can never remember it.
The jugular, the
jugular
carotid.
that were stenosis. So if I did anything for any amount of time where, like, hanging out with friends, I noticed that if I was turning my head a lot, that's all I could figure out on my own, that it was making me, I couldn't function the next day. So I figured it was something from here. So when Dr. Jenkins said that was what it was, I was like, it made sense. Anyhow, before the surgery, I had vertigo, dizziness, pre-syncope. I was getting the blood flow and the spinal fluid flow to my brain was compromised. I had stenosis, so I was getting intracranial hypertension. My blood flow, I wasn't breathing right. My SpO2, my blood oxygen was way down. I was completely confused. I had trouble talking. I was bedridden. I had a big bad headache, shortness of breath again, tachycardia again. And the diagnostic thing, if I went to the ER, they do is a spinal tap. And I can't do that with Ehlers-Danlos because it might not heal, and then I get a leaky spine forever. And even the blood patch doesn't always work for that. So I kind of held off, and that was as I was waiting for a full diagnosis and surgery. And we did the stellate ganglion block, and put me in the collar, and my symptoms did go away. So it was determined that an occipital to C2 fusion would hopefully fix me. And I also have Eagle syndrome. Both of my styloids are over 4 centimeters. And Dr. Jenkins was able to, so I went into my fusion thinking I was going to come back out and have to get those clipped. But Dr. Jenkins was able to tilt my head in a certain way where they're actually not pushing on anything. Because one was pushing on my thyroid too. So that saved me another surgery. I know when he went in there, was a little twisted, so that would be more on the clinical side. So I don't think I had even the typical rare, you know, whatever it is he does back there. What it was what I'm looking for.
Fusion.
Yeah, so I didn't have a typical fusion, I would assume. But it came out wonderful. There was no complications. My surgery, I believe, was a couple of hours. My pain, post-surgical pain, was really mostly in my shoulders and in the back of my, more occipital back here, and it was more muscle spasms. Mm-hmm. I did not really have pain at the surgical site, which surprised me. I thought that would be terribly painful. And it really wasn't a terribly painful recovery. And I know that's what a lot of patients going into it are like, what is my recovery going to be like? And what is my life going to be like afterwards? Recovery is totally manageable. I know there's a lot of people like me who just get a lot of surgeries. So we're kind of used to that surgical part, but the thought of having your neck fused and maybe the pain of being so close to your nerve, well, all around your nerves and your spine, that you would come out a total mess. And I actually looked at myself in the mirror after surgery and I said, wow, you look great, because my color was back in my face. My eyes were bright. I almost looked relieved. And I am. So I 3 months post-surgical, 3 months, and I got on a plane and went to Nicaragua. It was 14-hour door-to-door both ways, and I feel great. So I'm tired. I think for me, that takes me a while to get over anesthesia. I also have Ehlers-Danlos still, so that it kind of gives you chronic fatigue syndrome. Fibromyalgia is one of our comorbidities. I think I've given myself that it would still be a year recovery, and I say that in the sense that my body's got to adjust to it. I have other stuff going on, like my ribs dislocate. I've got, still got my Bertolottis. But as Dr. Jenkins says, let's start from the top. And he's like, actually, your body kind of starts correcting things on the way down. So my ribs felt great. I used to had some, idiopathic, nobody could figure it out, pressure, pain, under my, on kind of where my heart is. So, it gets confused with chest pain. I'm like, it's not heart pain. All that's kind of gone away. I had brachial radial pruritus, which is also kind of rare. It's a nerve condition, and you can't not scratch. And so you scratch until you're bleeding. And I have had that for several years, and I haven't had that since. I had one very short migraine, meaning that I got aura, no headache, since my surgery, and that was after my travel to Nicaragua. So that's, to me, that's more food change and environment change. And we suspect I have mast cell MCAS. So that's my next test to figure that out. So we think, which I'm surprised that I still don't have any dizziness or anything like that. So having some trouble swallowing, my voice, it's really gone away. So, and this is my range of motion. So I can go up and down. I can go like that. That's about it for there. But we can change. I'm driving, no problem. I'm using more muscles in my back to drive, just to look over my shoulder, because I love to use my mirrors. I'm fully functioning. My days are longer because I don't shut down very quickly. Usually I was good only for about 4 or 5 hours. And now I can do all, as we call them, all dayers, which is a day without a nap.
It's a
We're
good one.
so it was so much. We go to bed at 8 o'clock. So, but so that's me rambling. So if you want to ask more specific
Yeah, sure.
questions
No, so
that you want, I can do
yeah,
that.
sure. So curious about just your low back. I know you have Bertolotti's syndrome. But
Yes.
do you notice any changes so far? I mean, with that or anything like that further down the line?
No, actually, that is, and that's also why I'm saying here. So my lower back is worse.
Mhm.
My whole body is worse. And what it is that with Ehlers-Danlos, is we need our muscles to be strong to hold our our bones in. So our muscles are working extra hard to keep everything in place. I've had shoulder surgery. This one still pops out. This one still pops out. My hips pop out. Just sublux, and so because I wasn't able to exercise pre-surgery because I was such a mess, post-surgery because I'm recovering, and I'm starting my PT next week.
Okay.
On Tuesday. So I haven't even started any of that. So I attribute my pain that I have that's increased to, we get pain flares. So I'm either in a flare, I haven't been able to exercise. So I think, once I get myself out of that whack of having a big surgery and not being able to exercise, get my exercise back in, I will be able to manage my Bertolotti's. And that's what I've said to Dr. Jenkins, is that I think he's like, well, what do we want to do there? I said, I want to get back to, because I've been managing it for over 25 years.
Mhm.
When my first sciatic pain started, and I was okay before. So, and the other thing is I found a great new PT guy who's like, your lower back's all whacked out. And I'm like, yeah, but it's always been. And so we started adjusting my hips and I think that sent me out of whack. So that's where my pain started, which led me to get the MRI. I'm like, no, my back's messed up still. So I got my MRI, which Bertolotti's cervical. So I think I should be able to, but that's a whole other
Right. Okay.
thing. Yeah.
Um,
So
and then in terms of, so we had you in the collar for for about 3 months after surgery, correct?
yeah.
So how did you find navigating life with a collar on all the time?
Um, I think life with a cervical collar on all the time. Specifically, I was in a Vista collar, the long one that came down. I had to sleep in it, and then I had a Philadelphia collar to shower in. So it's 24/7. I think I got used to it pretty quickly. Also, because as soon as when I put the collar on, I got my life back. So I actually, before, I've been in it for 4 months, because as soon as we figured out that's what was keeping me bedridden, I left it on. So we had the diagnosis, and then I wore it for about a month. So I wore it the 2 weeks to get my diagnosis, and then I had 3 more weeks to wait for my surgery, and I just stayed in the collar because I was functioning. And like anything, I got used to it. I there are certain days post surgery, and I think it's a combination of surgery, anesthesia, opioids, and collar, or it was, take this off me, get it off me. But that was, I think maybe one day, definitely maybe 2 days, kind of spread out, just more emotional, I think, of just being overwhelmed with everything. And I think it was more anesthesia related for me. It was just, you know, overwhelmed with the whole thing. But putting the collar on and wearing it for that amount of time, it's, adjusting life to not being able to drive. But so we'd go out every Saturday, and I'd get to do the grocery shopping because I love to do that. So mind you, because of the surgery, I'm completely functioning. I just can't do stuff because I was still in the collar. So, my suggestion for somebody wearing a collar that long is, get out, gets, somebody to take you and do the things that, make you happy. Just, quick little outings, and that kind of breaks up the cabin fever or whatever, the frustration of But it was walking. The only thing that was holding me back from walking and doing that, kind of exercise was just energy level, and that was related to the surgery.
What would you tell a patient that like has similar symptoms to you, has similar symptoms to you, and is trying to find a solution to what's going on with them?
I would say if somebody has cervical instability, I would say definitely pursue at least getting the diagnosis with Dr. Jenkins. It just, when he diagnosed me, and it was big and scary, and I can tell you, people, who know me, they're like, wait a minute, what's going on? What surgery are you getting? Because I went from diagnosis to surgery so quickly. And it just, I'm like, if somebody can see what was wrong with me and find that, when so many people have looked at me and not understood, I'm like, that he can fix it. So to me, it made sense. And I think if somebody's living with symptoms of cervical instability, which are so vast and varied, but you pretty much end up bedridden, there is a solution. And if a cervical fusion is your solution, it is life-changing. Yeah, I can't move my head like that, but I have my life back. And I highly recommend it. And that there are people out there to talk to, and who you can, ask tons of questions, and, and see, decide for yourself, and take your time deciding for yourself. But
Right. And so you're from Virginia Beach, so not local. How did you find navigating sort of the distance from and having the surgery and then leaving town and things like that? Because I know a lot of patients are sometimes reticent to just fly out or drive long distances to an out-of-state provider. So what can you tell us about that in your experience?
For me to travel to New York City from Virginia for my surgery, and I actually went up earlier to get my diagnosis because I was so excited that he's like, when we were at I think it is stage pre-diagnosis, that I wanted to meet Dr. Jenkins, and also too, I needed my stellate ganglion block, and I wanted it done by the people that Dr. Jenkins works with. So I flew up for that. And that was diagnosis, and that was easy. But I flew up for my surgery. I stayed in Manhattan. There's plenty of options for different price points, and then there's different hotels that'll work with medical and give you discounts and stuff like that. So I know it's New York City, it's Manhattan, but it's not cost prohibitive for that, and it's actually pretty cheap. You can fly into New York. For me, it was just one leg from Norfolk, Virginia to I flew into LaGuardia, and navigating everything was fine. And I stayed at the Marriott on the Upper East Side, so I wasn't too far from Mount Sinai, and I wasn't too far from my follow-up appointment at Dr. Jenkins' Manhattan office. And I would say, traveling to have surgery, not at home and not at the comforts of home, and not going home right after surgery because you've got to stay, for 7 days for your to get approval to go back home. It's fine. You bring your comforts, you ask different people, what should I bring? What should I do? And there was nothing that I would have changed. I wouldn't have changed my mind because of the distance. I was traveling to get the care that I needed. And I even went alone and had the surgery in the beginning, and then my husband met me afterwards because he needed to be home, and that was fine. And I flew home, and I was fine. So it just, the travel really was not an issue. It's not, again, it's not, being at home and but it didn't matter at all. And Mount Sinai was a fantastic hospital. I had a shared room. I know being in the hospital is never easy, as post-surgical, never easy. It was my first, actually, I've had some overnights but that was my first multi-day stay in a hospital. And it went really quickly, actually. So it was fine. And I was up, the same day that and up walking around and doing all that stuff. So I wouldn't say the travel was a deal breaker. Absolutely not. And I think anybody it can do it, even if they're going, cross country. And again, I had my energy back. I felt great. I felt better after my surgery anyway. So I was worth coming in for it than going home, which may sound weird, but
Right.
it was easier going home.
Oh.
You think it's going to be like this terrible, huge experience. And it's, you're still I went into it in a collar and I went home in a collar. It was,
Right.
fine. Yeah.
Well, I think that's it for me, but if you wanted to,
Yeah.
if you had anything, I'd like you to maybe say something to Dr. Jenkins, like address him this last
Yeah.
bit. If there's anything you want
Okay.
to say to him.
Okay. To Dr. Jenkins, I say, you've saved my life, and I know that. And I asked you after. No, I don't want to say that, because I never want to say that, because I asked him afterwards. I said, if I don't want you to use this.
Yeah.
If I hadn't had this surgery, would it have killed me? And he said yes. So I don't like talking about that to other people at all. I mean, to my family, but to other patients in the same thing, because I don't want it, even then, I don't think it's a reason to do the surgery if you're not ready for it. Mm-hmm. So, but to Dr. Jenkins, I say, at 57 years old, being faced with undiagnosed, idiopathic, chronic, debilitating symptoms, disorders, you're the first person in my life who has been able to diagnose it and actually just look at me and say there's a solution, and give me hope and give me an actual solution, giving me my life back to function, to enjoy and look forward to the things that I have in my life offered to me. And I'm a little later in life now, so I have grandkids, more coming, marriages, and going from being bedridden and picking and choosing, what I could do, if anything, having my life to be able, that I can decide, not my body, is amazing. And I think your expertise is, out of this world. I just had a feeling with you just when I met you and you diagnosed my cervical disorders, which are quite significant and critical, that I was like, wow, let's do this. Let's fix what we can fix with you, Dr. Jenkins. And also understanding Ehlers-Danlos and being able to, put my whole body together, and my body with me, the person, the patient, Katherine, is it's life-changing. And I thank you for being here in December and September when we got started. This has happened really quickly, and I look forward to keeping it going. I think the other thing that's amazing about Jenkins NeuroSpine is that I went and sent my x-rays. I had my first video conference for my diagnosis in September, and I had surgery and was done in December. And I know there's people, because I'm on different groups on Facebook, and people struggle for years on wait lists to get diagnosis. No, we're going to, jack you up with tons of shots first because, and do all these other things before we'll even think about the surgery. I can't do the surgery, yeah. So it just to being able to have access to care and to surgery and in a expedient time frame when it was critical for me. I was actually I was critical with with my symptoms and yeah.
Great. Well, thank you so much, Katherine. Thank you for your time.
Yeah.
I'd love to see a picture of you, in Nicaragua or doing something that you couldn't do before.
Okay.
So that'd be great just to kind of see that.
Yeah.
That's nice. But
Yeah.
that's it for me.
Yeah.
Yeah. Thank you for being so thorough. And like I'm thrilled that you are feeling better. You know, it's it's a scary prospect to be like, okay, you need
Yeah.
surgery, occiput to C2. I mean, like that's not a small surgery. And so
No.
going through that obviously takes a lot of courage and faith and, also takes an expert to know how to diagnose that and how to proceed with that. And so
I want to give you a soundbite just from what you said. Can you still record?
yeah,
Okay.
I'm still recording.
Are you still recording? I would say going for my C0 to C2 surgery, that deciding to do that surgery is a leap of faith. It really is. You have to believe in your doctor, you have to believe in yourself, and you have to believe that you're going to be better. You are. You're definitely going to be better. And with Dr. Jenkins doing the surgery, it's a leap of faith to believe that he's going to do a good job. And I took that leap, and I'm glad I did. And I know I did an excellent job. And I know that it wasn't a typical fusion back there for me. And he was able to do it, as it was going along. I think I was twisted a little bit, and he was able to correct that. And of course, my styloids from Eagle syndrome. But yeah, I just wanted that soundbite that it was a leap of faith. Yeah, because I always say that people are like, how did you didn't you read? I'm like, research, and I'm like, yeah, I did my due diligence, but it's the leap of faith no matter who you go with. So if you feel that, you feel that connection, that you go for it.
Right. Right.
Anyhow, so thank you.
Thank you so much.
Yeah.
Hope
No, but if there's anything, and and he's got me talking to somebody who's considering he needs surgery, but he just wants to talk about it first. But yeah, I'm happy to do any of that. But
thank you so much. This will help a lot of people. So
yeah, hope so. Thank you. All right, Sarah. It's so nice to meet you.
Yeah. So have a great day and rest up.
You too.
All right. We'll talk
have
to you soon.
a good week. Okay, thank you.
Bye.
Bye.